When are we getting out of here?
I'm not sure. The nurse should be in soon to give you all the discharge instructions.
Yeah, I'm kind of ready to go. They wouldn't let me smoke or nothing in here.
Yeah. Come in.
Hi.
Hey.
Hi.
Hey, what's
My
going on?
name's Rochelle. I'm your nurse, and this is Saya. She is my student nurse precepting.
From San Jose State.
Okay.
Yeah,
Oh,
so
good
she's
for
about to
you.
graduate.
It's exciting.
Am I
Yes.
about ready to go home?
You are, but we wanted to go over some of your discharge instructions.
Okay.
But I want to start off by saying thank you for admitting that you're not willing to quit smoking, but you are willing to stop using chewing tobacco. I want to say that's really great that you're making progress toward the goal, and maybe down the line we can quit smoking.
Yeah, they wouldn't let me use it in here, so I guess I'm kind of stopping cold turkey. Plus, my brother he's pushing me to stop chewing at least. So.
Yeah, that's great.
We'll start with that.
So Eric, here's the handout we would like you to take you home.
Okay. So what's neutropenia?
So based on your recent lab values related to your lung cancer and the chemotherapy that you've been having, you're considered neutropenic, which is a condition that occurs when you have a lower than normal white blood cell count, in particular the neutrophil part of the white blood cells in your body. Neutrophils are there to help you fight infections, and so since yours are low, you don't have as many neutrophils in your blood helping to fight the infections.
What causes that?
So some causes can be bacterial or fungal infections, allergic disorders, reactions to some medications. Also, it can be caused by conditions. For example, in your condition, cancer and chemotherapy lowers your neutrophil count.
So he's more prone to infections.
That's right, yes. So we wanted to give you some teaching about what you can do to limit your likelihood of getting a severe infection.
Okay. So the neutropenia was caused by the lung cancer, or was it from the radiation chemo stuff I had, or yeah? Okay.
It was caused by the chemo.
Okay.
Some symptoms that we want you to be aware of are fever, chills, swollen glands. If you ever have a cough or shortness of breath, a rash, skin infections, and fatigue, those can all be signs that you have a low neutrophil count, that you're neutropenic. Any questions so far?
No. The only thing is I have a constant cough and shortness of breath, so.
Because he's been a smoker for so long.
Yeah, so it'll be kind of hard to figure that out, but.
That in combination with your low count could be a cause of that cough.
Okay. So how do I keep from getting infections?
We have some home care instructions for you. We recommend to only take over-the-counter medications as prescribed by your doctor. We recommend getting a seasonal flu shot to protect yourself from that. We recommend not eating unpasteurized foods and don't eat unwashed raw fruits or vegetables. You want to stick to more cooked vegetables. Avoid exposure to groups of people or children, large crowds. Avoid being around other people who are sick. Avoid being around dirt or dust in construction areas or gardens. Don't provide direct care for pets. Avoid animal droppings, and don't clean up litter boxes or bird cages.
Some of that's going to be a little hard on my ranch, so I don't know.
When you say unpasteurized foods, what kind of foods are you telling us to avoid?
Feta cheese.
Okay, like soft cheese,
Mm-hmm.
Raw fish?
Raw fish.
raw fish. Okay.
Mm-hmm.
Yeah, I don't like raw fish.
Fish isn't pasteurized, so.
Oh, good.
All right.
So in terms of hygiene, we recommend you bathe daily. And you want to clean the area between the genitals and the anus.
Oh, wow.
Yes. After you urinate and between a bowel movement. If you're female, that won't pertain to you. We recommend brushing your teeth with a soft toothbrush before and after meals. And don't use a razor that has a blade. Use an electric razor to remove hair. Wash your hands often. Make sure others who come into contact with you also wash their hands with soap and water or hand sanitizer. General instructions include don't have sex unless your healthcare provider has approved it. Take actions to avoid cuts and burns. For example, be cautious when using knives. Always cut away from yourself. Keep knives in protective sheaths or guards when not in use. Use oven mitts when you cook with hot stove, oven, or grill. Stand at a safe distance away from open fires. Avoid people who have received a vaccine in the past 30 days that was a live vaccine. Do not share food utensils. Don't share water bottles. And you want to make sure to keep all appointments as told by your healthcare provider. This is important.
So lock myself away in the barn and don't touch anybody.
So you're not going to be able to work on your ranch.
So I would like to teach you how to do the proper hand washing so that every time you wash your hands are clean, and that greatly improve your chance of getting infection. So make sure there's a running water. Enough friction is the key. Friction actually cleans your hands. Make sure you clean between your fingers like this, the back of your hands. Make sure you cover the thumbs, fingernails like this. You can wash them like this, like that. Wash your wrist. Please use plenty of soap. And make sure this washing should be at least 15 seconds. So you can sing 2 ABC songs in your head or any favorite songs you like. After that, you take a clean paper towel or a clean towel, dry completely, and use another paper towel or clean towel and close the water. And you're done. So make sure that my instruction was clear. Would you please repeat that for me?
You said use warm or hot water and some friction on my hands when I'm washing them for like a couple of songs like ABC or Happy Birthday or something like that. And clean my nails, and then nails this way, and hands like this way and this way. And then keep doing it through those songs in my head. And then when I'm done, I turn the faucet off with a paper towel or a cloth.